Welcome to JS Skinners. Today we are going to discuss the infection control precautions. So we will gonna discuss standard, droplet, airborne and contact precautions. So stay with me till end of this video and you will be clear about this topic. Let's start without wasting your time. Okay. So सबसे पहले अपनी बात करते हैं स्टैंडर्ड प्रिकॉशन की. Okay, standard precaution क्या होते हैं? Standard precaution is applied to all patients regardless of diagnosis, which means जो standard precaution है वो आपको यूज करने हैं चाहे पेशेंट को कोई डिजीज है चाहे नहीं, क्योंकि ये आपकी सेफ्टी के लिए हैं और पेशेंट्स की सेफ्टी के लिए हैं. When you are attending any patient, you need to follow these things. This is called standard precaution. Basic level of infection prevention used for every patient. This is the definition of standard precaution. What includes in it? Hand hygiene before and after patient contact, gloves when touching body fluids, mask, gown, eye protection if risk of splash, safe disposal of sharps, cleaning and disinfection of equipment. What are the examples of standard precaution? Blood contact, body fluids, urine, saliva, and wound drainage. Wherever you see this, it means you just using the standard precaution. Patient don't have any disease, but you still need to follow these steps. Second is contact precautions. It is very simple, which prevails by contact. It can be a direct or indirect contact. So if you're touching a patient who have contact precautions disease, and if you are touching the surroundings of that patient, still that can happen, right? Now, how it transmit? Touching infected patient or contaminated surfaces. What PP required for contact precaution? Remember this: gloves and gown. You don't need mask because this is prevailing by contacting the patient. Patient placement, single room preferred. So if patient have a contact precautions, patient must be in single room, because if any other patient is with that same patient staying in the same room, it can prevail to another patient as well. So it is must that patient stay in single room. Okay. What disease come under contact precaution? So these are the diseases: MRSA, VRE, Clostridium difficile, and scabies. So this you can learn. For examples, whenever you are attending your medical exam, this can be asked. So you can remember these are diseases which come under contact precautions. And what nursing actions? This is just important. Wash hand with soap and water. Always wash hand with soap and water, especially if patient have Clostridium difficile. Clean environment frequently. So this can be something done to prevent the infection. Okay, and just remember, so what you have to remember about contact precaution is PP required gloves and gown, and what disease come under these, and the definition is spread by direct or indirect contact. That's all about contact precaution. Now we're going to talk about droplet precautions. So by the name it says droplets, so it prevail by the droplets spread through large respiratory droplets. Transmission can be from coughing, sneezing, or talking. The PP required for droplet precaution is surgical mask. It's must if patient have a droplet precaution. If you see patient you attending outside of the room droplet precaution, you must wear a mask. The patient placement should be required in single room or maintain 1 meter distance. What diseases are come under droplet precaution? You can remember these: influenza, COVID-19, meningitis, pertussis, which is whooping cough. So these are the diseases come under droplet precaution. Nursing actions: wear mask when within 1 meter. If you are within 1 meter of that patient, you need to wear mask, and this is must. You cannot negotiate. Patient should wear mask during transport. If करते हैं last, airborne precaution, as it says, it prevails with air. So spread through very small particles. Stay in air. Transmission: tiny particle remain suspended in air and travel long distance. Okay, PP required, N95 mask, respirator. So you must need to remember that N95 mask is required in airborne precautions. Patient placement in negative pressure room. Common diseases under airborne is tuberculosis, measles, chickenpox. Nursing actions: keep door closed, limit patient movement, use N95 mask before entering. We're gonna quickly summarize this. Quick memory trick. Airborne, N95 mask. Droplet, surgical mask. Contact, gloves and gown. Standard for all patients, and you need to use hand hygiene, PP when required, handling of sharp disposals. Everything come under standard precautions. I hope this video is helpful for you. If you found this helpful, share with your friends.